Did you know that poor sleep doesn't just make you tired the next day? It's actually washing away your brain's ability to remember, think clearly, and protect itself from dementia. Here's the alarming truth that should wake you up right now. Recent research from the University of California, Berkeley found that adults over 60 who consistently get poor quality sleep have a 27% higher risk of developing cognitive decline within just 5 years. But here's what most doctors won't tell you, and what I'm going to share with you today. It's not always about how much you sleep, it's about the habits surrounding your sleep that are silently sabotaging your brain health. I'm Dr. Nereta, and today I'm going to reveal 5 sleep habits that millions of older adults are practicing every single night, completely unaware that these patterns are accelerating cognitive decline. More importantly, I'll give you the exact science backed strategies to reverse each one starting tonight. Let's dive in because your brain health depends on it. Before we get into these 5 critical habits, let me explain why sleep is absolutely non negotiable for your brain health as you age. During deep sleep, your brain activates what scientists call the glymphatic system. Think of it as your brain's overnight cleaning crew. This system flushes out toxic proteins, including beta amyloid and tau, which are directly linked to Alzheimer's disease. When you disrupt your sleep patterns, this cleaning process gets interrupted, and those toxic proteins start accumulating in your brain tissue. A groundbreaking 2019 study published in Science showed that even a single night of sleep disruption increased beta amyloid levels in the brain by 5%. Now, imagine what years of poor sleep habits are doing. But here's the good news, and I want you to really hear this because it's incredibly empowering. Your brain has remarkable plasticity, even after 60. By identifying and correcting these 5 habits, you can literally start healing your brain tonight. The first habit that's destroying your brain health is something almost everyone does without realizing the damage. It's going to bed and waking up at wildly different times each day. Maybe you stay up until midnight on Friday watching movies, then force yourself to bed at 9 p.m. on Sunday. Perhaps you sleep in until 9 a.m. on weekends, but wake at 6 a.m. during the week. This might seem harmless, right? I mean, you're still getting sleep. But your brain operates on what's called a circadian rhythm, an internal 24-hour clock that regulates everything from hormone production to memory consolidation. A 2023 study from Harvard Medical School tracked 1,800 adults over age 65 and found something shocking. Those with irregular sleep schedules, varying their bedtime by more than 90 minutes, had significantly smaller hippocampal volumes. That's the brain region crucial for memory formation. Why does this happen? Because your brain releases specific neurochemicals at specific times. Melatonin rises in the evening, cortisol peaks in early morning, and growth hormone, which is essential for brain repair, surges during deep sleep. When you constantly shift your schedule, you're essentially giving your brain jet lag every single week. So here's your step-by-step plan to establish consistency. And I promise you, this is easier than you think. Choose a wake time you can maintain 7 days a week. Yes, including weekends. This is your anchor. Let's say 7 a.m. Now count backwards 7.5 to 8 hours. That's your target bedtime window. For a 7 a.m. wake time, you're aiming for 10:30 to 11 p.m. Set 2 alarms, one reminder 30 minutes before bedtime to start your wind-down routine and your morning wake alarm. Then stick to this schedule within a 30-minute window, even on weekends, for at least 21 days. This is how long it takes to reset your circadian rhythm. Now, if you absolutely must have a weekend variation, and I understand life happens, limit it to 30 minutes, not 2 or 3 hours. Your brain will thank you. The second habit that's silently destroying your cognitive future is something millions of older adults rely on, and they have no idea they're trading temporary sleep for long-term brain damage. I'm talking about sleep medications, whether prescription drugs like Ambient, over-the-counter antihistamines like Benadryl, or even natural supplements. While these might help you fall asleep faster, they're compromising your brain health in ways that should terrify you. Here's what most people don't realize, and this is crucial. Sleep medications don't produce natural sleep. They produce sedation, and there's a critical difference. A landmark 2015 study published in JAMA Internal Medicine followed 3,400 adults over 65 and found that regular use of benzodiazepines and Z drugs was associated with a 51% increased risk of dementia. Even more concerning, anti-cholinergic sleep aids like the diphenhydramine and Benadryl have been linked to accelerated brain atrophy. Why is this happening? Because these medications suppress REM sleep and deep sleep, the exact stages where your brain consolidates memories and clears out toxic proteins. You might be unconscious for 8 hours, but your brain isn't getting the restorative sleep it desperately needs. Now, if you're currently taking sleep medications, please don't stop abruptly because that can cause rebound insomnia. Here's the safe transition plan. Schedule a conversation with your doctor about gradually tapering your medication. This typically takes 2 to 4 weeks. While you're tapering, implement what's called sleep restriction therapy. If you're in bed 8 hours but only sleeping 6, limit your time in bed to 6 hours initially. This builds sleep pressure naturally. You need to address the root causes because most sleep medication use stems from anxiety, pain, or poor sleep hygiene. Work with your doctor to treat these underlying issues. Replace medication with evidence-based alternatives like magnesium glycinate, 300 to 400 milliamers about 2 hours before bed, which supports GABA production. Consider cognitive behavioral therapy for insomnia, or CBTI, which has been shown to be more effective than medication long-term. Try progressive muscle relaxation, which activates your parasympathetic nervous system. And here's an important note. If sleep apnea or restless leg syndrome is causing your sleep issues, medication isn't the answer. Proper medical treatment is. The third brain-damaging habit is something you're probably doing right now, or at least you were doing last night. It's exposing yourself to artificial light, especially blue light from phones, tablets, or TV in the hours before bed, or sleeping with lights on in your bedroom. Light is the most powerful regulator of your circadian rhythm. When blue light enters your eyes, it hits specialized cells that signal your brain's suprachiasmatic nucleus to suppress melatonin production, your sleep hormone. A 2022 study from Northwestern University found that adults who slept with even modest bedroom lighting showed increased insulin resistance and elevated heart rates during sleep, both risk factors for cognitive decline. But here's the brain-specific concern. Disrupted melatonin doesn't just affect sleep quality. Melatonin is also a powerful antioxidant that protects your brain cells from oxidative damage. Research published in Neurology showed that people with lower nighttime melatonin production had significantly higher rates of cognitive impairment over a 7-year follow-up period. Let me give you a light-optimized environment plan for brain health. I call this the 2-hour rule. Stop all screen use 2 hours before bedtime. I know that sounds extreme, but start with 1 hour and work your way up. If screens are absolutely unavoidable, enable night shift or blue light filters on all devices. Wear blue light blocking glasses after 7 p.m. Get ones that block at least 90% of blue light and keep screens at least 18 inches from your face while dimming them to minimum brightness. Now let's optimize your bedroom. Install blackout curtains or use a sleep mask. Cover or remove all light sources, even tiny LED lights from electronics. Use red or amber night lights if you need them for bathroom trips because these wavelengths don't suppress melatonin. Here's something powerful you can do. Get 10 to 15 minutes of bright outdoor light within 30 minutes of waking. This anchors your circadian rhythm and makes it easier to fall asleep 16 hours later. Quick test for you. Your bedroom should be dark enough that you can't see your hand in front of your face. Now let's talk about the fourth habit. And this one surprises most of my patients because napping seems so innocent. Many older adults nap during the day, especially if they didn't sleep well the night before. While short naps can be beneficial, long naps, anything over 30 minutes, or late afternoon naps are sabotaging your nighttime sleep and your brain health. Sleep is regulated by two processes: your circadian rhythm, which we've discussed, and sleep pressure, the building need for sleep throughout your waking hours. Every hour you're awake, a chemical called adenosine accumulates in your brain, making you progressively sleepier. When you take a long nap, you release this sleep pressure, making it harder to fall asleep at night. But here's the brain health connection that should concern you. A 2023 study from University College London analyzed data from 378,932 adults and found that people who regularly napped for more than 1 hour had a 40% higher risk of developing Alzheimer's disease. Why is this happening? Researchers believe excessive daytime napping may indicate underlying neurodegeneration or disrupted nighttime sleep architecture, both harmful to brain health. It creates this vicious cycle. Poor nighttime sleep leads to daytime napping, which further disrupts nighttime sleep. Here's how to break the napping cycle and protect your brain. If you must nap, and sometimes you absolutely need to, limit it to 20 to 30 minutes maximum. Set an alarm. This provides restorative benefits without entering deep sleep. Timing matters tremendously. Never nap after 3 p.m. The ideal nap window is between 1 and 2 p.m., aligned with your natural circadian dip. If you're napping because of poor nighttime sleep, address the root cause rather than treating symptoms with naps. Resist the urge to nap and build up sleep pressure for better nighttime sleep. If drowsiness is severe, try a 10-minute walk instead of a nap. Here's something that sounds contradictory but actually works beautifully. It's the strategic caffeine nap. If you're absolutely exhausted and must nap, drink a cup of coffee immediately before a 20-minute nap. Caffeine takes 20 to 30 minutes to kick in, so you'll wake up naturally and feel alert. The final habit that's silently destroying your brain health is eating large meals or consuming alcohol within 3 hours of bedtime. This is one of the most common habits I see in my practice, and patients are genuinely shocked when I explain the brain damage it causes. When you eat close to bedtime, your body diverts resources to digestion instead of sleep restoration. Your core body temperature needs to drop 2 to 3 degrees Fahrenheit to initiate and maintain deep sleep, but digestion generates heat, preventing this drop. A 2021 study in the Journal of Clinical Sleep Medicine found that eating within 3 hours of sleep increased sleep fragmentation by 30% and reduced REM sleep by up to 25%. Remember, REM sleep is when your brain consolidates memories and processes emotions. Now, alcohol is even worse, and I need you to really understand this. While many people think alcohol helps them sleep, it's actually one of the worst things you can do for your brain. Yes, alcohol makes you drowsy initially, but research from Washington University School of Medicine shows that alcohol suppresses REM sleep by up to 40%, causes sleep fragmentation in the second half of the night, interferes with your brain's glimpy cleaning system, and directly damages neurons in the hippocampus. Even moderate alcohol consumption, just 2 drinks, reduced brain volume in critical cognitive areas, according to a 2022 study in Nature Communications. Let me give you an evening eating schedule that optimizes brain health. Finish your last meal at least 3 hours before bedtime. If you sleep at 10 p.m., dinner should be done by 7 p.m. What if you're genuinely hungry before bed? Have a small protein snack only, Greek yogurt, a small handful of nuts, or chamomile tea. Avoid sugar, refined carbs, or anything over 150 calories. The best option is 1 tablespoon of almond butter because it provides sustained energy without blood sugar spikes. Now, let's rethink alcohol. If you drink, finish alcohol 4 to 5 hours before bed, not 3. Limit to 1 drink maximum. Better alternatives for relaxation include magnesium tea, tart cherry juice, which contains natural melatonin, or herbal adaptogens like ashwagandha. Here's a hydration strategy. Stop large amounts of fluid 2 hours before bed to prevent midnight bathroom trips, but keep a small glass of water bedside for genuine thirst. Many people eat or drink at night to manage stress or boredom, and we need to address this emotional component. Replace this habit with an evening walk, gentle stretching, reading physical books, not screens, or connection with loved ones. Let me recap the 5 sleep habits that are sabotaging your brain health and exactly how to fix them. Habit 1 is inconsistent sleep schedules, and the fix is maintaining the same wake time 7 days a week within 30 minutes. Habit 2 is relying on sleep medications, and you fix this by working with your doctor to taper safely while addressing root causes. Habit 3 is light and screen exposure fixed by no screens, 2 hours before bed, a blackout bedroom, and morning light exposure. Habit 4 is long or late naps, which you fix by limiting to 20 to 30 minutes before 3 p.m., or eliminating entirely to build nighttime sleep pressure. Habit 5 is late eating and alcohol, fixed with the 3-hour rule for food, 4 to 5 hours for alcohol, and small protein snacks only if needed. Here's what I want you to understand, and this is so important. You don't need to fix all 5 habits overnight. That's overwhelming and sets you up for failure. Instead, choose one habit, the one you know is your biggest problem, and commit to changing it for the next 21 days. Track your progress. Notice how you feel. Your brain's neuroplasticity means that even after years of poor sleep habits, you can start experiencing improvements in memory, focus, and mood within just 2 to 3 weeks of optimization. Remember, every night of quality sleep is an investment in your cognitive future. The habits you practice today determine whether you maintain sharp mental clarity or face cognitive decline in your 70s, 80s, and beyond. If you found this information valuable, please hit that like button because it helps us reach more people who need this information. Subscribe to the channel for more evidence based strategies on healthy aging, and drop a comment below telling me which of these 5 habits you're going to tackle first. I read every comment, and I'm here to support your journey to better brain health. And if you know someone, a parent, spouse, or friend who's struggling with sleep issues, share this video with them. You might be protecting their brain health for decades to come. I'm Dr. Nereta, and I'll see you in the next video, where we'll discuss the surprising connection between gut health and cognitive function. Until then, sleep well and protect that incredible brain of yours. All from Dr. Nereta, Senior Health.